I'm here at Australian Healthcare Week with over 6,000 other people across different healthcare verticals talking about all the important problems to solve within healthcare today. I'm up on the digital health stage moderating sessions, and we're covering everything from examples and use cases of how to implement technology in a hospital setting, opportunities to service patients from within their own home and in comfortable settings, and putting data back in the hands of patients to be able to solve critical problems. We talk a lot about the future of healthcare and emerging technologies like artificial intelligence and machine learning to transform how healthcare is delivered. Here at the Talking HealthTech booth at Australian Healthcare Week, THT intern Tony and Talking HealthTech partnership manager Sophie are having conversations with speakers as they come off one of the many stages here at Australian Healthcare Week here at the Talking HealthTech booth. I'm going to run back to the digital health stage and continue to moderate. Collaboration starts with the conversations in health tech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
So I'm Dr. Emily Kirkpatrick, and I'm the Executive Medical Director within the Calvary-Medibank joint venture, and I'm also here today as a Board Director of Southern Adelaide Local Health Network. Amazing. So as a Board Director of the Southern Adelaide Local Health Network, you just sat on one of the panels. Can you tell me a little bit about what you were talking about and the discussion that you guys had? So it's very exciting to be part of the healthcare. What do we expect over the next 15 years to 2040? And a focus for us, and we had a number of different panel members, including the CEO of IHACPA, was talking about what do we need to do around funding and system reform to ensure that we're meeting the equitable needs, particularly for our multicultural communities. And so one of the areas I focused on was around disability. And we know with the recommendations that came out from the Royal Commission last year was there were 15 recommendations for health services. And that included both recommendations around education, so education for GPs and primary care practitioners, but also ways that we can help bridge the gap, because we know that individuals living with a disability, in fact, have 2 decades shorter life expectancy. So plenty of work we can be doing as a health service. And I was really excited to be able to talk through around what we're doing as a board, but also more broadly, where there's opportunities for us to really focus in on our communities and ensuring vulnerable community groups get the support they need in our health services. And what were some of those areas that you were focusing in on today? Yeah, so an exciting area that we're sort of looking at more and more is around virtual and digital technologies. So we know, for instance, the virtual hospital that we run through the Calvary-Medibank joint venture has now delivered care to 220,000 patients across the country and more than 12,000 patients within South Australia. Now, a focus within that is how can we support individuals who do much better off receiving care within their homes? So we deliver acute Tier 1 activity whereby someone would be otherwise admitted into an inpatient bed can receive that care in their home. And one of the factors we sort of work towards is, well, what can we do for the disability sector and particularly supported independent living? What can we do around digital initiatives and virtual care? So we're very proud to deliver care for those particular individuals, and we adapt that care and make sure that it's precision-based and it's tailored for what it is that individual needs. So on the panel today, we were talking around what does the future look like, and virtual technology, virtual hospitals, how we can deliver that acute care to someone who doesn't want to come into a hospital or someone who's better off receiving that care in their home. I think that's what's most exciting about the next 15 years.
Yeah, absolutely. I would agree with you on that. My experience is working rural and remote as well. So I love that we're moving into this digitally enabled space where we can make health, it's more equitable and accessible to our regional and remote areas of Australia as well. So it's some great examples that you guys are putting forward in South Australia. What are some of the takeaways from the rest of the panel that you insights that you gained from today?
Well, we definitely had funding conversations, and having the IHACPA CEO, was really important for us to sort of unpack what does this look like. We know the Independent Hospital Pricing Authority now has aged care as part of that, and we had a discussion around, well, what does private health insurance look like over the next 15 years? What does primary health care look like from a funding perspective? And will there be a national body to support what that needs to be as part of the reform piece? So, certainly my background as a GP, we know that primary care is not sustainable the way it is. And so a real takeaway that we sort of all agreed on the panel was there has to be change to make the system sustainable. And I think one of those key areas that how do we as a Commonwealth and from a national perspective create change in the funding models. I mean, funding can be boring to many people. We know clinicians struggle with how hospitals are funded and the activity-based funding models. But we know that if we're going to have a sustainable healthcare system where we spend 10.8% of our GDP on health here in Australia, we've got to be smart with how we use the money. So for me, the take-home was we've got to all come together collectively and look at how we fund the broader healthcare system, including the private health insurance space, primary and community care.
Yeah, brilliant. Well, thank you for your time today, Emily. We look forward to seeing you again soon.
Thank you so much.
I'm the Chief Medical Officer at Healthdirect Australia. I'm responsible for all clinical operations and clinical governance. I also have experience as a general practitioner across 3 countries internationally, also medical retrieval and emergency work. And my digital health journey started in Singapore working for a UK startup who were pioneering artificial intelligence in a symptom checker that I led the localization of across 11 Southeast Asian countries. And I'm so fortunate to have been able to apply such knowledge to Healthdirect, who recently rolled out an AI-powered clinical decision support system for our nurses to use on the Healthdirect helpline, as well as for consumers to use as a symptom checker on our website and app.
Wow. And so today we're at Australian Healthcare Week and you've been on the stage. Can you tell me a little bit about what you spoke about today?
I spoke about the challenges we faced in implementing the clinical decision support system. And this started right from the beginning of the journey in, firstly, identifying that we needed an AI clinical decision support system because we needed something to actually look like it was a real consultation. So I needed to take into consideration multiple symptoms, ask about chronic disease, also to consider individual risk factors like travel history, for instance, as well. It also needed to provide a more dynamic interview in that it adjusted questions according to the answers. So the first challenge was deciding we needed an AI system. And secondly, was actually finding one that would met our needs. So following an international procurement exercise with very stringent clinical requirements and clinical safety requirements, we narrowed down to 5 international vendors, did extensive clinical testing, and then found one that met all our needs. After finding it, we needed to localize it for Australia because this was a European product. It needed to include Australian-specific diseases. For instance, it didn't have brown snake bites or jellyfish stings, which are very particular to Australia. And we also needed to make sure it was specific for the Australian epidemiology. After localizing for Australia, the next challenge was, well, how do we get people to use this on the helpline? The CDSS, or Clinical Decision Support System, aids our nurses in triage. They are able to apply their own clinical judgment to the output, and ultimately the decision lies with the nurse. But the nurses still need to have trust in the CDSS, and they need to be able to use it correctly. So one of our biggest challenges was actually getting the nurses to be able to use it comfortably. Having used a decision tree algorithm previously that only took into consideration a single symptom, for the nurse to enter multiple symptoms took a bit of change in behavior in how you take a history from a patient and which symptoms you actually enter into the symptom checker as well. The other challenge we had was a black box event where the nurses using it don't really understand what is the product that they're using. So we have to educate the nurses at a high level on how a CDSS is built, how the medical knowledge base, which is at the core of the product, is actually based on evidence-based information. And the output has been clinically validated. In fact, the CDSS vendor that we procure the product from ran test cases on over 8,500 scenarios to validate it as safe. Once we got the nurses on board, the next challenge was to actually ensure that it was providing safe information. And we encouraged the nurses to provide regular feedback, which we continuously fed back to the CDSS vendor, who maintains the product and continuously improves it. And the CDSS vendor has been extremely responsive and has continuously updated it. So with every software release every month, puts into effect changes directly in response to clinical feedback. And what do we see a year later? Because it's actually a year later now that we've implemented the CDSS. We've had no serious adverse events directly attributable to the CDSS. The Net Promoter Score from our consumer surveys show that consumers are the happiest they've been in 3 years, with a Net Promoter Score of 93%. Our nurses are actually feeling far more comfortable using it with the updated user interface. We have listened to them and we've updated the user interface so that it's more effective and efficient for them as well. And we've received unsolicited compliments from our nurses on the upgrades. And we've also demonstrated that the CDSS has become more accurate over this time as a direct response to the continuous improvement with the feedback. How do we know that? Because we repeated all of the testing in December last year on our symptom checker, which has the same model or same engine as our tool that the nurses use on our Healthline. Our symptom checker is, of course, consumer-facing in that it's on our website, it's on our app, and no nurse interface in between needed to ensure that it was providing safe and accurate advice to our consumers using it. And when we launched in December, we performed safety testing, and it showed that the accuracy had actually improved since the launch of the nurse-led triage tool. And if anybody's curious about the tool that I've just described, it's actually something you can use yourself on our website and our app. You can run a few symptoms through. Of course, when you do need to run symptoms through, please go ahead and use it and see for yourself the power of AI.
Yeah, I think it's so exciting to hear some really positive stories about how our AI is being implemented and used, and the amazing outcomes that you guys have experienced in the last 12 months, and that with that work and constant improvement, we can really start to trust the technology and use it to solve the problems and get the patients the care that they need.
Absolutely. I mean, our consumers, ultimately what we want to do is provide safe care to the consumers. And all of the work that we do needs to be consumer-centric. And our consumers are happy. I'm not sure if they noticed the change, but our nurses certainly have.
Yeah.
And it also shows the power of feedback, of us listening to the people using the product, of getting them on board on how you perform the change management required. That you can't underestimate the change management required in getting healthcare professionals to use new technology to perform old tasks that they were accustomed to. So we've learned so much through this journey, and we're taking those learnings on as we continuously innovate at Healthdirect.
Yeah, amazing. Well, thank you for your time today. I'm really looking forward to see where things are at in another 12 months.
Awesome. Thank you for having me.
Thank you.
So Ken Saman, the CEO of Personify Care. We're a digital health solution provider that helps clinical teams convert their clinical models of care into what we call a digital patient pathway, managing that journey to an appointment or an admission into hospital, and then managing their transition back into academic advice, discharge, or straight home.
Amazing. And then on the stage yesterday, what were you talking about?
Yeah, so yesterday we had the opportunity to share the stage with Professor Chris Barnett, who is the geneticist and the head of the innovation team within the Commission for Innovation and Excellence in Healthcare in South Australia. And they've partnered with us to develop a digital consent pathway for patients, for children actually that are having genetic tests. And so that process of getting informed consent from those patients, where patients are waiting sometimes up to 4 years. Chris Barnett was talking about how his wait list is 4 years for patients waiting for genetic testing. And so getting proper informed consent for patients, in this case parents, is really important so that they understand the implications of genetic tests for them and their family. and doing that in a way that doesn't create a bottleneck in that patient's experience, but doing it in a way that's legally proper and would make sure the patient actually understand what it is they're meant to. So yeah, just on stage talking about how we've supported that project and how that's gone live in South Australia. So they've created some animations around what that information needs to look like. They've got a whole pathway around that, managing that process and making sure that patients truly understand what it is they're signing up for, and even from a clinical perspective, making sure that process is creates a whole bunch of efficiency for the team is doing.
Yeah, and how are the the parents finding the new process? Is it a lot easier in terms of understanding that informed consent?
Well, I think as Professor Chris Barnett was saying yesterday, I think one of the key things that they're achieving with this is giving parents the time to consume this information in their own time, rather than having to sign a paper form right then and there.
Yeah.
Particularly where parents are involved, and sometimes only one of the parents is attending the appointments. It's really important for them to have the time to consider the cases of what it is to. So the experience for the patient now is Professor Chris Barnett will invite them onto a pathway prior to their appointment. They're able to provide their family history in advance of that appointment, so that the clinical team have access to that prior to their appointment. That way the clinician has access to the information in advance, and they can spend their time with the patients, actually spending more time on the high-value component that is set. And their patients can go away after the appointment, receive all of that information in an animated video and a whole bunch of information that they might review, and they're able to sign a digital consent form at the right time after they've watched the animation and answered a bunch of questions up throughout that contain my confidence with them truly honest journey.
Yeah, amazing, especially in that genetic space where it's very complex, so you're unpacking all of that. So what are then the key outcomes of that, and then where to from here?
Yeah, so I think based on an initial pilot that was funded by the Commission last year, that's now been been rolled out in SA, business as usual. I think a lot of the other states are now looking to achieve within the South Australian context and exploring opportunities to start to replicate some of that. And I think part of the story we were telling yesterday on stage is that really consent is one step in the patient journey, and that's part of what we're trying to do here. Is our platform supports the entire patient journey from the first point of contact with the health service all the way through to that they're transitioned back to the community once they've had the treatment and procedure. So having consent is one part of the step, rather than having a different solution or a different way of engaging with your health service just for no consent pieces, I think really important. So in the South Australian context, they're getting a response rate of just over 88% to those pathways. They've translated the animations into whole different languages. So it really makes it a really seamless experience for the patient as I'm picturing.
Yeah, amazing. Well, thank you for your time today, Ken.
Thank you.
Look forward to seeing where it all goes.
Excellent. Thank you, Wayne.
So Tim Deveson, I'm the account director at Genesys, looking after our healthcare vertical. I've been with this company for just over 12 months, but been in the healthcare industry my whole career. Started as a podiatrist clinically, and then went into medical sales, and I've been in the digital health space for about 7 or 8 years.
Wow. All right. Podiatrist through to sales and the stage at Australian Healthcare Week.
Yeah, really fascinating journey. Love every minute of it. I think the nice thing for me is I'm probably more passionate about the industry and exploring growth within the industry because I've seen it from a clinician's view. I've lived in the world of the procurement days in the bottom end of hospitals, selling wrist braces to shoulder braces, and now I was sort of fortunate to get involved in the digital health space just prior to COVID, and understanding the difficulties we've got in our ecosystem. And through the last couple of roles, I've been working in digital or patient engagement as such, and now with Genesys really focusing in on patient and employee experiences and how globally, we're starting to try and break down some of those barriers.
Yeah, amazing. And it's been such a hot topic at the moment, and certainly trending in terms of how we're doing it and how to do it better and enhance that journey now that we're hitting more on that digitally enabled healthcare.
Yeah.
What were you presenting on the stage yesterday?
Yeah, so I sort of presented a bit of an insight of where Genesys, from a healthcare perspective, views patient and employee experience. And at the end of the day, our system, and we're working with probably 650 health customers globally these days, it's very much around patient access. So how do we get more engagement proactively to patients from care providers, from healthcare organisations via their channel of choice? So, I talked about accessing patients in the right channel at the right time, be that voice, be that email, be that SMS, being able to utilise multiple channels based on patient choice rather than a health organisation just having one channel. So we're delving into this concept of omni-channel in healthcare. It's sort of been murmuring for a while. Genesys is really passionate about that. We bring that from our contact centre background. And it's got a really strong play in health in the way that I see health consumers are wanting to engage on channels outside of voice.
So what have been the biggest takeaways or lessons for you guys so far?
So I think globally, a couple of the key sort of stats that we're talking about when we visit these with some of the major hospitals, particularly in the US, is use of things like self-service bots for identification and verification. And critically, that's taking away some of that handle time or workers' time before routine inquiries. I think in one of our major hospital groups, they've had a 20% reduction for what date's my appointment, where's the car parked, and my blood tests in. So that's not necessarily replacing human interaction. It's actually utilising technology to support human interaction for patients to have a better experience. And I think that the second stage of that is the enhancement of digital capability. So using digital channels as that first line of communication rather than relying on the phone. And every person has the classic example: they call up a health organisation 3 times in one day. They don't know who they are. They didn't know that they called in 20 minutes ago. The person they're trying to get to is not available. We constantly live in that world of disjointed experiences. And I think as a technology vendor, we're trying to assist stitching that together.
Yeah, and if you can improve that patient experience, it's a nicer human-to-human interaction when you finally get to that in the hospital. And
equally then, I think the context coming to the employee or the care advocate is they've got all that information. That's already been done, so their life is better. Yeah, and I think I said to someone recently, if we could give you back 2 minutes of your time every day in every interaction, if you say yes, it's a no-brainer.
Absolutely.
And arguably, people will say to me, "Oh, Tim, you are trying to replace humans." We are absolutely not. We're allowing technology to function alongside us, to assist. And I think that's really powerful.
Yeah, absolutely. Well, looking forward to seeing where it goes and keeping in touch.
Yeah, fantastic.
Thanks for your time today.
Appreciate it. Cheers.
Okay, so the one-sentence summary is that I'm a clinician and a nerd. Yeah. In a little bit more detail, I've been a doctor at the coalface for 25 years, working mostly as an intensive care specialist, but I'm also trained and ticketed as an anaesthetist or anaesthesiologist for the American viewers. And most of that work was in the public sector in New South Wales, so working in the hospital system. But before I did that, I've been a nerd for longer than that, 40 years. Yeah. I was writing, selling and supporting software, including a practice management solution that I sold ending in about 2000, so 24 years ago. I've been involved in IT rollouts in healthcare at various levels, from intensive care to whole of system rollouts. And more recently, I guess, having the dual knowledge base as a clinician and an IT specialist has meant that I've taken up roles like Chief Clinical Information Officer, which is what I am now in Northern Territory, which is sort of blending acting more as a translator, helping clinicians understand the way IT people speak and executives, helping the executives understand clinicians and IT people, and helping the IT people understand clinicians and executives.
The nerd and the clinician intersect.
Yeah. Although the third language, I didn't really talk much about it because that's a fairly recent experience for me. So I first started having an executive role in 2014 when I was the CCO for New South Wales, which is exactly almost exactly 10 years ago. So that's a relatively recent learning curve for me, and it's probably been the hardest learning curve for me. But that third language is increasingly critical, because in the end the executives decide where they're going to invest, where the money gets spent, what are the priorities for the business. And so if you can't speak to them in a language they understand, you don't get far.
Yep. Okay. So then this last couple of days, you have been on quite a few panels here in Australia.
One still to go. Yeah.
One still to go. What has been the highlight for you so far?
Today we talked about healthcare anywhere, anytime. And really interestingly, it talked about clinicians as well as patients. And that one actually, it's not just because it's the one that's freshest in my mind. It was actually probably the most interesting one for me. But at the beginning of the conference, we were talking about design centricity and using human-centered design to create better solutions for people. And we also had a session on AI. But I actually think they all centre around the same principles, which I think, okay, so probably a bit of positive reinforcement, having, or what do they call positive affirmation bias. But I really feel that if we constantly think about who is going to use our solutions, how and who's going to be impacted by the use of our systems, how do we design the solutions to best meet their needs, really understanding what problems they have, then we'll build great solutions. It doesn't matter whether it's an AI solution or a standard technology, whether it's a piece of software or a widget, a physical device. I think those things are critical. But I guess the sessions also reminded me that we're very different. A lot of people say, why can't health do, what Instagram did or Facebook or Twitter or whatever? Why can't we do that all-encompassing? And I was thinking to myself, it's very, like, if you were a startup and you gained 10% of the world's market, or how many users are there every day on Facebook? Like, it's a huge number, but it's still only small compared to the world's population. Problem with healthcare, everybody needs healthcare, not 10% of the population. Like, I can turn off my Facebook account and Insta account, many people do, and life goes on, but you can't turn off healthcare. So we have a much harder challenge, because we've got to create solutions for everybody, not just a small minority or even a majority. We have to make it work for everybody. And I think a lot of our failures are around, this works for 90% of the population. Well, in Australia, that means 2.5 million people wouldn't get what they need, because 10% of 25 million, So I think that's what's come home to me today, that I think a lot of our failures is because we don't really think about all the people we have to support. We don't think of the edge cases, the vulnerable people. And so when we're designing our solutions, we often, make it work for a lot of people, but not the people that need it most. And that's been woven in every discussion that came up in various ways. So I think that's probably the common theme that I think I've enjoyed raising awareness of, I guess, and not just me, other speakers. It's been a common theme that's sort of evolved through the panels.
Yeah, sure. So then, as that theme's evolved, what have been some of the discussions around that? How do we go forward and create that whole?
Yeah. Well, one thing I feel is great is that if I think about, and I'm trying not to reflect just my own opinion, so if I think about the discussion on the panels, there was certainly a much greater acceptance that human-centered design, human centricity is going to create better outcomes than not, and that's really good, because 10 years ago I wouldn't have said that would have been on the forefront. I think understanding the needs of the edge cases, the vulnerable communities, the cultural and linguistically diverse communities, the special needs of people that are not always front of mind. I think everybody mentioned the needs to address that, whether we're talking about bias and AI solutions or building tools that can't be accessed by people of a different language group or disability. So I think that was another one that was really, really strong. And I used the term stopping being so egocentric and I think that's also reflective, because we for a long time have talked about healthcare as if it only ever happens in hospitals and general practice and specialist rooms. And I think over the last 10 years, and this has been really strong in this conference, we've seen the drift away from that to realise that there are other clinicians involved in healthcare, allied health professionals and others, but there's also non-registered practitioners, everybody from alternative medicine practitioners, massage therapists, unpaid carers. They're all critical to your health, because 98% of your time you're in their hands or your own hands, not classic Western contemporaneous medicine's hands. And I think I've seen the gradual I don't want to use the word attack because I think it's a good thing, the gradual dissolvement of the egocentricity of discussions. And we're talking much more about patients in their environment where they need care. And not just patients, the carers too. Like I used an example today of doctors who are providing support to Northern Territory whilst they're sitting in France and Germany because it's daylight over there, so they can provide our nighttime service. So it's not just about the people receiving the care, it's about the providers too. So I think those three things.
Well, it's great to meet you, Sophie. My name's Gareth Sherlock. I am a former CIO with Cleveland Clinic and recently moved back to Australia and been working for myself, helping a number of health systems and consultancies to either take on transformation projects in Australia or potentially move their organisation to Australia to try and capture some of the exciting things that are happening here in the market.
Brilliant. So you're having a wealth of experience from across the seas.
Absolutely. So, my background is really doing, large and complex transformations and also, taking on large roles within organisations in the technology space. I was the former CIO with Cleveland Clinic London. I was there for 5 years. I saw that project right from the beginning of construction all the way through to the first year and a half of hospital operations. And then before that, I was with Cleveland Clinic in Abu Dhabi. I was there nearly 9 years, and I was in a similar role. I was the CIO for 4 years and an exec director before that. And I also saw that project right from the beginning, actually just before construction started, through to the first 4.5 years of hospital operations.
Yeah, it's amazing. All right, so bringing a wealth of knowledge to the panels today at Australian Healthcare Week. Can you tell me a little bit about what panel you were on and what was some of the discussions that happened?
Absolutely. So I think the purpose of our discussion this week was to talk a little bit about what's happening and has happened in the market outside of Australia. So I was speaking with a colleague of mine, Ed Marks, who is the former CIO of Cleveland Clinic in the US. And he has a wealth of experience as a CIO in North America. He is currently got his own consulting business and has been consulting to a number of health systems, both in North America and internationally. We really sort of talked a bit about some of the work we've done with Cleveland Clinic in North America and globally, and some of the exciting work we've done there, really to bring some of the lessons learned and experiences we've had on those projects and transformations, and hopefully share that with the audience and bring some of that knowledge to the group.
Yeah, so what are some of those lessons that are really transferable to the Australian healthcare landscape?
Absolutely. I think one of the really exciting things that Cleveland Clinic have done is they've really created a truly globally integrated health system. All the hospitals globally are on the same electronic medical record, and we've really tried to drive standardisation across the whole health system globally. And that's something that's quite unique in healthcare. When you think about healthcare, I sort of describe it as a very tribal industry. You can have a hospital, in the centre of Sydney, and you walk down, drive a couple of suburbs away and go into a different hospital, and they're completely different. The workflows are different. One's on paper, one's using an electronic medical record, and to be honest, that leads to the level of care and quality of care being different. Necessarily better or worse, but it's not. You're not getting that benefit of standardisation and best practice being brought industry-wide, which I think we've seen in other industries, but healthcare is really, far behind from that perspective.
So what were some of the key takeaways then in the broader discussion today on the panel?
I think there's a couple of things we talked a bit about. One of the big things that, I think Cleveland Clinic do well, and it is really important for organisations to be successful, is, focusing on the culture of your organisation. And culture, whether it be, within a hospital and the organisation, and, being a patient-centred organisation, it's focusing on great outcomes, or potentially when your organisation is going into a transformation, that you have the culture within the organisation to ensure that they're ready for that big change and that big transformation. So we talked a lot about culture, and also we talked a little about some of the lessons learned. What were some of the success factors that we had on some of the large transformations we did within the clinic? What did we do well? Where did we learn lessons? What could we have done better? And there were sort of two big areas we discussed.
Yeah, amazing. So for the Talking HealthTech audience that haven't been here today, what is something that you'd like to leave with them then?
Okay, well, a couple of things. One is, when you're thinking about culture, it's something that you don't just create, you have to build and build from the ground up. And we talked a little bit about having a culture of gratitude. One of the things that I think is really powerful is having that sort of culture of gratitude and being a true serving leader for your caregivers within your organisation. When, times get tough, gratitude is really important. And, I got told by my previous CEOs that, when the times are tough, you should double down on the gratitude. So that's probably one takeaway. Another takeaway is, and when we talked a bit about large transformations and what are the things you need to do to try your best to sort of make sure you're successful. There were sort of 5 things that I mentioned that are really important. One of them is culture. The other one is having the right stakeholders engaged on that particular transformation. Picking the right partners, whether that be system integrators, vendor partners, and the like. Having the right caregivers. You need to make sure when you're going on a transformation, you have the right people involved at project. Transformations can be complex, lots of change, lots of variability, lots of uncertainty. Often, that's difficult for some people. Some people love it. You need to make sure you pick the right people for you to do already that. The next thing was governance. When you go on a transformation, you need to put the right governance in place. One, very quickly I mentioned was you need governance and the right governance, not process for the sake of process, but process that, ensures that you have the right, things in place to make that project successful. And then the last thing was, financial stewardship. And it sounds obvious, but on, big complex projects, you can often have challenges with timelines and budget, but you need to make sure, you're a really good financial steward.
Yes. Amazing. Well, thank you for your time today. Really appreciate it.
Thanks, Sophie. Great to meet you, and I really enjoyed the discussion.
So I'm Voni Leighton. I'm the clinical director and one of the co-founders of Vitalis Health Care. They're based in Sydney, and we're an organisation that provides at-home services for clinical acuity patients. So hospital at home, keep therapy, one-part care, those sorts of things. Yeah, I also do rehab and ICU complex care, so patients that have a high level of ventilation, the spinal injury, the septic phase as well. Yeah.
So do you work on providing those services or regulating the upkeep of those services?
Yes, we provide those services.
Yeah, awesome.
Yeah, so we work in partnership with hospital groups and health partners to provide those services for the patients and their members.
Awesome. And what brings you to Health Week? Anything specific?
So I'm here to meet with healthcare providers, to meet with clinical directors, to really connect with former colleagues and friends, and also to meet new ones.
Nice. Okay. Do you go to many events for health around Sydney, or?
I do. I went all over the country actually, and international.
Oh, great.
So it's very much about connecting with people and helping to further the conversation about healthcare in the Dublin way.
So, and if someone was to meet you or to come to your booth, what would the main takeaways be that you would like them to take away from it?
Well, I think what's important for all of us is collaboration. It's about working together. It's about understanding what each other's needs are, working out how we can support a patient and keeping the patient at the centre of everything. And I think an awful lot of people that are at this type of conference are very much about patient-centric care delivery. So it's about making sure that we are addressing the patient's needs, making sure we're addressing the needs of our funders, our players, and really collaborating and understanding if there's new ways, new treatments, new advances in care, and sharing that information rather than keeping it to ourselves.
Yeah, and that's the best way to do it. Okay, well, it was really nice to meet you. Thank you so much for sitting down with me.
And lovely to see you.
Thank you.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.